Yate Abene, Vice President Lizer here. Thank you for joining us on this August 3rd COVID-19 Town Hall update. At some point, I was hoping that we could change the name of these updates. We do realize the importance that these updates bring, these town halls bring to the nation. It would probably be a good idea to continue these for just any other reason other than COVID-19 updates. So, but here we are, still in the realm of the pandemic, and we again are hoping to mitigate this virus and the spread. And so today is about that. Talk about the updates, the new numbers, the variant spread surging that's going on all throughout the whole Navajo Nation. So we do look forward to changing the name of this town hall update at some point when all is better, when we're given the green light, where this virus has ended, but we're not there as of yet. So, but thank you for joining us again. This is Vice President Comanche Nishlet Tolhan Bashashin Ado Comanche Deshache Ash Deshanelli. It's good to be with you all here again. Just giving updates. We have our president, Dr. Jill Jem. We have our EPI team from the Navajo Nation HCOC. So all of our health professionals here. Dr. Brian Johnson, our captain, Brian Johnson, trying to give him doctor status here. So, but we do have our health professionals here who will give you the information and the needed data, the latest data as we are going through this virus, this pandemic. So, but we appreciate you joining us again. I'm going to open up in prayer, pass it on to our president, Jonathan Nez, who's waiting in the wings. So, yeah, Shajadi and God, we thank you that we are about the nation's business, Lord, that in this pandemic, Lord, there's the need for leadership to pass along information and data so that the nation can run with the information, Lord, and steer clear of the virus, keep their families safe, Lord, and make decisions, Lord, in real time. So we thank you again. We pray for our health professionals, Lord. Thank them, Lord. We thank them and thank you, Lord, for giving them the gift and the provision and the capacity to be about the care of the Navajo Nation and all of our people, Lord, here, keeping them safe, Lord, and also just being the awareness piece, the mitigating piece from this virus, and everything that they've learned in medical school and becoming a nurse and all that, Lord Father, is to the benefit of the Navajo Nation, our people, Lord, in which we serve. So, God, we ask for your wisdom, your knowledge, Lord, that we could send out the information to the people, that the people of the land may be blessed. But also, Lord, that we also work like it depends on us, but we pray like it depends on you, which it does, our Creator God. So thank you for preparing us for this time and preserving us for this time, Lord, as we look for provision from you, Lord, the King of Kings and the Lord of Lords, Lord, and the Creator of heaven and earth. You know all things. This pandemic did not take you by surprise, but we access your good grace and mercy, Lord Father, for the love and the benefit of the Navajo Nation, this land in which you set us upon. So we thank you again for this time. Be with us, Lord, that we can come forth out of this pandemic and this virus will be stopped and that healing will come on the land. In Jesus' name we pray. God. Amen and amen. So thank you again for joining us. Facebook Town Hall event here, August 3rd, 2021. So without further ado, ladies and gentlemen, the president of the great Navajo Nation, Mr. Jonathan Nez. Sir, take it away.
Thank you, Vice President Shana. Nakatsurin Sinigido, Nakayan Chito, Naka Kung na Tadan Nagi ba ke needs an anil sukwa. Ado di Hanen Hijikondeli, Adamona Atlea, na Kijinda and the Shuna Nesna or Kilo AD, the Cousins Kagina has AIDS ata, Bikiji. Ndale nashigi bikije nde bahagido yikeni hidna kon banane shidel inigido nihido ahead dan hidi nekodo tsala hotzanda has ada yina nish adal inigi here ado ade KABR Alamo, New Mexico, that da isunoltsagi Sarah Apache here kudohanen yichikuin la do ane la da isunoltsa ado la ainle New York da istsa la do tunne je adon le the nebiki apokao da isunoltsagi do benago do kida hatnigin hinant ado istsa la Macarlo Roanhorse Ganado dan ado lanko da isunoltsagi here la kwa hanen yichkunde. Thank you for joining us again on another town hall meeting to give you updates on the pandemic and what the Navajo Nation is doing here to push back to fight this virus. And let me just say too that thank you so much for the hard work that you're doing. You're all on the front lines and you're following protocols. And I'll show you in a bit what I mean by keeping this virus at bay um, by following these protocols. You know, we've been seeing some cases go up and down, go up and down. But thank God that we don't see some high cases like we seen last year. So thank you. And we see, but we see a lot of folks following those protocols. You know, you got to follow those protocols in schools. You got to follow protocols at the chapter meetings. We can't have gatherings, large numbers. We even for funerals and churches and others. But that is the reason why we've seen some very little cases. You know, and I was supposed to be back at the home community of Shanto, Arizona, to help with the funeral of Sna Ash Leo Jim Sr. He was raised in Shanto and worked many years at the Navajo generating station, 42 years. And his wife, Arlene, for 40 years. And they have 5 kids, 5 children. And our thoughts and prayers go out to the Jim family. He was there for many years at the power plant, Lake Powell, and worked closely with the Black Mesa Railroad, and he was a rancher. So bedlin halon den do be kashi halon da ina yila kitsa jitten English shant tode khode shidin den lai kwa na nesto do la atlande kle ta no jo edo benina was do akonde she kodo shla ashe net ba ishla do le so benanish yilagi la nache hot au benanish il on ba alchin il toke nalike so din do ba ana ke benache gon mit an jotza ado ishin kodo ni keni na aje ke tinigi but so deal sendo le so bejedo ben das le konde each dog hato kodoba you can't see zingo da ka nature how da ka na alwo da each dog hato konde beje do beda beche benalda la she a nasi tikdole. So wanted to say that today with the funeral happening at the gravesite in Shanto, and our thoughts and prayers go out to my cousin, my brother, my relative there in the community. One of the items that we wanted to bring your attention is the Navajo Nation employee vaccination rate here on for, I guess, not just in Winter Rock, for all Navajo Nation employees. 82% of our Navajo Nation employees have been fully vaccinated. And we are moving toward a vaccination mandate for our Navajo Nation employees. Of course, there'll be some exemptions. Those that get exemptions are going to be required to uh, get tested periodically. So, but we do want to encourage our Navajo Nation employees to get fully vaccinated. But thank you to our employees, 82% fully vaccinated. That's a big percentage that we have here on Navajo. So if you go to the first slide there, Eli, 31,421 of our people here have contracted the virus. In 24 hours, uh, there have been 9. So we saw a spike into the 20s, right? Over the weekend, we went 20s, 26, I believe, was the highest, I think. And then it started to go back down Monday and Tuesday, and yesterday, 9 positive cases. And I just want to reiterate that uh, the contact tracers have been doing an excellent job. The healthcare professionals there, they find out who's positive, they isolate them, and then our departments give out food so that they can stay isolated. Not much of an increase in emergency room visits because people are vaccinated. Uh, Thank you to our healthcare professionals. I think we should all give them a round of applause for doing an outstanding job. But it's back on us, ladies and gentlemen, when it comes to being very careful. Uh, we travel. I jokingly say this, but it is really important that we wear our mask. If we choose to travel off the nation, please wear your mask. I know it seems like peer pressure when you're off the nation, you see nobody wearing masks, you feel like everybody is looking at you when you wear your mask. Let them look at you. They don't know, they're not going to know who you are anyway because you're wearing a mask, right? So just continue to wear your mask when you're off the nation. And here on the nation, we have a mask mandate. So here, it's no worries because everybody's wearing masks. I went to Bashes yesterday. The temperature checks are going to go away, but you'll still be required to, take care of yourself by hand sanitizing and wearing your mask as you go in to the Bash's supermarket. But when I was going in, there was a gentleman there that said, "You all have a mask mandate, right?" And we said, "Yes, sir." And he just nodded his head. He was very appreciative of that. And that was our visitor that came in. And I'm sure there's other visitors that are not so happy about wearing a mask, but uh, they should understand by now that Navajo has been hit hard by this virus. Total confirmed deaths 1,377 in 24 hours. No new death. We thank God for that. Uh, we also continue to pray uh, for those who've lost loved ones and those that are still directly impacted, healthcare wise, health related wise, uh, for their recovery. So social gatherings, please, really no social gatherings out there. Uh, there's a cap on social gatherings at 25, and some events off the Navajo Nation that we go to, rodeos and revivals and things like that. Just again, just be careful. Think of our family members, especially our kids, because our children don't have um, the shot yet. So if you go to the next slide, it'll show you, that slide also shows you the breakdown of cases in all 8 service unit areas, including off Navajo Nation. The next slide shows you the progression, and you can see we've been doing very well since March. Maybe the end of February, you see the long, low numbers, and thank you so much, Navajo people, for your hard work. You know, the media came out when we were high in percentage, high in cases, and poor Navajos, right, all over. And I kept continuing to say we are resilient. We're going to overcome this. And then now that we're in low cases, everybody's spiking all around us. There's no media attention. This should be a positive thing for the region as well as to America to look at Navajo as a case study, as an example of how to keep the COVID-19 uh, virus at bay. But they don't want to see and tell the success stories because everybody politicizes wearing masks and staying at home. But we here on Navajo, looked at the bigger and the greater good here by saying that we're not wearing masks because we're being told that we're wearing masks because we're going to war. We're going to war against this COVID-19, and this is our armor. This is our protection and our weapons to combat this modern day monster. See, some people off the nation don't understand our way of life teaching. And our way of life teaching has got us thus this far in battling and fighting against COVID-19. So congratulations to Navajo people. You have been doing an outstanding job in keeping this virus alone in communities. But don't let up. Continue to fight the good fight, ladies and gentlemen. And don't worry about whatever other people are doing off the nation, as long as we continue to keep our children safe, our elders safe, ourselves safe. We're going to defeat this monster called COVID-19 here on the Navajo Nation. If you go to the next slide, these are the recent. This is just a small portion. It might look pretty severe, but remember this previous slide shows the entire progression of COVID-19 over the 16 plus months. This one here is just from June to today. And yes, there are some increasing cases. As you can see, it shows it's going up. But if you compare it overall from last year, you all are doing a good job in keeping the virus low. And then our contact. We learned a lot from last year, and we're putting that into practice. So you see there the last several weeks, you see some cases go up, and then we get it go down, and the spread happens, but the spread is stopped. Healthcare professionals are tracers. That's what I mean. Them a big round of applause. That's the CHRs and the doctors, healthcare professionals, the contact tracers. They're working as a team, and we get these updates every day or every other day now. Listen to what they have been doing, and even the epidemiology department for Navajo. I don't want to leave anybody out. There's just so much effort going into this. With our police officers, our frontline workers, everyone is doing a great job, including you as a Navajo citizen. Continue to wear that mask. If you go to the next slide, it just gives you a comparison of the United States and the Navajo Nation. And you can see the blue is the U.S. You can see that upward trajectory really increased quick. And you can see Navajo, just kind of going up and down, bouncing up and down there within the month of July. A little uptick because of the 26 that we got during the weekend. But let's keep letting our contact tracers know. And best thing to do too, ladies and gentlemen, just to stay on the Navajo Nation. The next slide there is compared to last week's presentation. Look at, we went down, or the states went up dramatically, right? You can look at it that way too. But the red line there, the first red line there shows the state of Utah with a big increase in cases. The second there on the slide that shows the red and the yellow comparison of the four states, The second line from the top is Arizona. And New Mexico is the third line, third red line. The fourth red line is Colorado. And look at Navajo Nation yellow. Compared to the states around us, we are low. So that's compared to the other states. If we go to the next slide, it shows you the states all around us. This doesn't show the Navajo Nation within the 3 states, but the concern is, you know, the dark red around us, the pink as well. We're still in yellow status here on the Navajo Nation, but I don't know. I hate for us to go back into orange, but these past 2 days we were in the single digits, so that continually keeps us in the yellow. So we'll be reevaluating that soon. I don't see any lockdown or anything like that happening anytime soon, as long as we continue to keep these numbers low and do that hard work. I'm sure we all don't want to go into lockdown or any stay-at-home efforts again. Let's help each other out. Let's get prepared. If you go to the next slide, it just shows you the variants. For the alpha or the UK variant, 123 have been found to be here. Because of the low cases, there's low variant numbers as well. The beta, the South African, we have 0 known cases here on Navajo. The gamma, which is the Brazilian, there are 4. The Delta, the India variant, 15. The Epsilon California variant, 20. Gamma, Boss, 4. And the Delta Epsilon is 22. And these are the variants. As you know, the Delta variant is the one that's really going up high, very contagious throughout the country, throughout the world. But here on Navajo, only 15 cases. I hate to say only, but that's what's really moving in this country. And here we see 15 at a very low number. So to end my update, I know this is a COVID-19 update, not a $1.8 billion ARPA update, but since some are asking, you know, yesterday we signed a legislation resolution to move forward on the American Rescue Plan Act funding. We accepted money. We're going to be developing a office to administer these big projects. You know, you have to be able to have an office of a large amount of dollars that are coming in to the Navajo Nation. And so we're going to be getting that office underway, all the environmental clearances, all the regulatory offices need to come together into one office, not like all these multiple buildings, all in one office, so projects can get done a lot quicker. Water line, electricity, broadband, telecommunication, home building, things like that. We are getting that underway. We're going to be having a meeting tomorrow with our council to begin to look at all these projects that are coming from the chapter house, make sure that they're ready to go and they're ready to move forward so that we can get these money spent in time. You know, I know some people are wanting a hardship check once again. You know, those are things that are going to probably be talked about tomorrow on Wednesday. But, you know, there are long-term needs, right? Long-term needs. Well, many of you that are watching probably don't live on the Navajo Nation, but one day you'll come home. And we want to be able to have water lines, electricity, broadband, telecommunication, other economic development projects to be done so that, you know, some of our people don't say it's the same old, or some of you that come home in 10 years or so say nothing's changed. We don't want that to happen. We want infrastructure development so that our people can come home. There has been a lot of people that have come home because of COVID-19, you know, lost their job or they just feel like they're safe here on the Navajo Nation. They come home. We just need more healthcare facilities. We signed a bill the other day on Sunday to put $2 million to the Canyoncito Band of Navajo's healthcare center there to support their expansion, you know, things like that, projects. The Western Navajo pipeline from Lichi area into Cameron, you know, we signed that bill, over $50 million to get that project done. You know, so there's going to be a lot of projects, but there's going to be a lot of projects throughout this country too. So that may mean us competing for contractors and builders and consultants, but I am hopeful that we will bring a lot of our professionals back to the Navajo Nation. You see our Navajo people building homes, building skyscrapers, doing things for other governments all across the country. Now is the time to bring them home and to build a nation, for our future, and so that they can stay home and help, you know, raise their families. And you know, we can do that for the next 3 years and do some permanent changes to make sure that these individuals, our Navajo people, stay home and look at nation building for the Navajo Nation. So thank you so much. I know there's lastly, Bear Son is on his way, I understand, from Indian Well or Delcon. And so he's on his way. Please, somebody give him a mask or remind him there's a mask mandate. I know Ishki Happy is looking forward to greeting Bear Son when he comes into the Navajo Nation fairgrounds when he does arrive. And so Ashki Happy and others, maybe even the NTUA mascots will come out and greet Bear Son as he comes through when he arrives. So be careful in that area. You know, don't stop on the road. Take pictures. We'll be working with him and make sure that he continues to walk, and he'll stop in every several miles maybe, and then there you can get your pictures and talk to him. He's walking for a good cause, but let's not stop him on his way or, you know, interfere in the traffic, because it could be dangerous too as well. So like I said, Shki Happy is happy to welcome Bear Son to the Navajo Nation. So that's going to be something to see. Thank you so much, Vice President. I'll turn the time over to you, and thank you everyone for watching our town hall meeting. Vice President.
All right. Thank you, Mr. President. Great update. Thank you for your leadership, sir. We appreciate it. The whole Navajo Nation appreciates it. We hear it from time to time. Leadership, along with our 24th Navajo Nation Council, have modeled great, I guess, adoption and adapting to this pandemic and keeping people safe. So appreciate your leadership, sir. Thank you. Yeah. And so welcome again. This is Vice President on this August 3rd COVID-19 Town Hall update, a time where President gives us updates, and we delve into health updates from our health professionals. So we look forward to hearing from them real quick. I don't want to be too long here, but I give updates on what the states look like around us. And we also give some other updates that are happening. So thank you, Mr. President, on the updates on ARPA, the one office there that we'll set up. And it's my hopes that this ARPA office, will outlive this administration and be a more permanent fixture. And sir, you're right. You took the words right out of my mouth. This is true nation building. This office potentially could be. Yesterday, we were blessed. I sensed that our Creator God was happy that leadership was there, and we signed the legislation and the law, ARPA office, and receiving the $1.8 billion. That our creator was happy that leadership was working together, and that was the theme yesterday. Mr. Speaker was there, and several of our delegates, Chair Nez, Vice Chair Smith was there, and Delegate Freeland, Delegate Stewart, and I forget who else. There's one more, and I can't forget that. It'll come to me. But we appreciate all their leadership. Delegate Walker, yes, we met there and truly working together. So, and then the rains came and the heavens opened and poured out. Such a blessing, I tell you. It was beautiful. Brought a tear to my eye. But I believe that is just a blessing from our Creator God that we're on the right track. We need to continue to be on the right track. Leadership does, and we appreciate the prayers of the people. I believe if there's, I know you're always asking for updates, you're always asking for information, you want true consultation. And I think one way, because not everybody can get it. We can't garner the input from all 400,000 of our members, right? But one way you can participate in is prayers. Prayers. Oh, those prayers are much appreciated. We can feel them. And we see advancement too. And I believe when we're all unified and truly our prayers are just asking leadership from our Creator God to show leadership how to work together, how to build projects, how to clear obstacles and the red tape and bureaucracy that has stymied the nation from advancing. I believe when our prayers are unified and centralized like that, I believe those obstacles can be removed and overcome. And again, we work like it depends on us, but we also pray. Well, we pray like it depends on our Creator God, which it does, And to Him be all the glory and all the honor and praise. And should this leadership, Nez Lizer and the 24th Navajo Nation Council get things done, it is to the glory of God. Amen. And so we appreciate all those that are working that. So real quick, my updates here. Vaccinations remain the most important public health priority, as you know, to reduce viral transmission and severe illness. Wearing a mask is what we preach, is what we do. Indoor spaces, including classrooms and work, and limiting large gatherings. It is all warranted and necessary to reduce the transmission in public settings. So that's what we wish for you all. News in the United States nationally, according to some of the CDC data that was leaked last week, unvaccinated people are 8.3 more times likely to be infected than vaccinated people. For all the believers and unbelievers out there, these are just information that you choose to believe or not believe, but really the data is there for those vaccinations to help the nation, the United States, and the world to reach what they call herd. What's that term? Herd. It'll come to me. You know what I'm trying to say. Herd immunity. There we go. So that's what we're all looking for. Again, praying that we could get to that point, praying that our God, Creator God, Shijadin God, would heal our nation. So those are all saying the same thing. So we appreciate your prayers to that end. Arizona, the University of Arizona public health experts say Arizona is now experiencing high levels of transmission that will be sustained for weeks to come. So another wave of cases and hospitalization are due to the Delta variant, which now accounts for more than 75% of all cases. So the variant is on the rise. So for the second day in a row, Arizona reported more than 2,000 new COVID-19 cases, the highest daily numbers since March. So it is real. That's what we're seeing out there, out and about. So 16 months into this pandemic, Arizona is reporting 933,361 cases total, with 1,974 new COVID-19 cases in the state of Arizona. Doing a deeper drill down there, Apache County, 11,786 with one new case. So good job, Apache County. Navajo County, 17,311 with 17 new cases. And Coconino County, 18,672 with 51 new cases to report. So got to be careful out there. Those in those areas, please just be aware. Higher numbers, higher chance of catching the virus, contracting it. Wear masks, social distancing, or just don't go there. So we appreciate these numbers. Thank you, Adam, for providing these numbers. My staff, Adam McGay. Next state, Colorado. Colorado has seen about 30% week over week increase in COVID-19 cases. This is being reported by the Colorado Department of Public Health and Environment. They reported 5,583 new cases in the week ending this past Sunday, which was the highest total since mid-May. So again, you're looking at data, we're seeing a trend. So how do we respond to that trend? Total cases 16 months in, 5,000, catch me, 577,285 with 488 new cases to report in the state of Colorado. New Mexico, as the Delta variant spreads, the New Mexico Department of Health is encouraging people to get tested. Get tested. So if you have any questions, please, testing still happening out there. There's still pods, there's still areas to get tested. So go to your nearest Department of Health and their website, and they'll give you that information. The increase in the respiratory illnesses comes as the New Mexico Department of Health anticipates many more New Mexicans to become infected with Delta in the coming weeks. So jumping from 25% of our cases to 80% in just a month's time. So you see that Delta variant rising. Please be safe. Total positive cases, 211,492 in New Mexico, 16 months in, with 1,076 new cases. San Juan County, 16,073, northwest corner of New Mexico there, with 64 new cases to report. And Gallup-McKinley County, 12,583 total cases, pandemic wide, since 16 months ago, and 40 new cases to report there in New Mexico, Gallup-McKinley County. Lastly, rounding out our quad state area, Utah. Utah Governor Spencer Cox called the recent spike in new COVID-19 cases in Utah a pandemic of the unvaccinated. In an update from the local hospital, reeling from the caseload. So Cox went on to share that today, 367 people across Utah need hospitalization for COVID-19. A month ago, there were only 266. Yesterday, the state reported 15 more Utahns had passed away from the virus. So it is real. It is out there. There should be no doubt. Total positive cases, state of Utah, 434,711 with 2,244. Wow. New cases to report in the state of Utah. So there are surging going on there. Please be careful out there. San Juan County there in southeastern Utah, 1,981 cases, 16 months in, with our own Utah Naval Health Systems reporting 1,129 overall cases here during the pandemic. So the Nez Lizer administration recommends and encourages the Naval public the following to stay safe and healthy during this time. Our recommendations include isolating at home if you test positive for COVID-19, quarantining and instilling protective measures after an exposure, testing, continual testing for COVID-19. Also, staying home when you're sick, physical distancing and grouping students and staff into cohorts, improving or increasing indoor ventilation, hygiene practices, washing our hands, sanitizing our hands, maintaining social distancing, and cleaning and disinfecting regularly, routinely, if not hourly, right? This is just the upteen best practice here to stay safe, and not based on fear, just based on the data and trends that's there. So I know when I do go out, I do exercise all of these. What our president has just said here, that, when we should just continue to maintain the status quo of fighting this pandemic, masking up. I see a lot of our people double masking, so that's great. That's good for them. So that's it on the COVID-19 updates. I do have some weather updates here. Increasing temperatures today through Friday could lead to heat-related impacts across the lower elevations of the Navajo Nation here. Isolated and scattered afternoon showers and thunderstorms on yesterday, today, and increasing through Wednesday through Friday. So moisture will increase again over the weekend with isolated to scattered thunderstorms returning. I know you see it. I know we see it and have felt it. And yesterday, what a doozy of a storm. It was beautiful but yet alarming. We are working on a plan to develop a water policy for the great Navajo Nation that'll speak to everything, every drop that comes onto the nation. So we're developing that now rapidly. The nation's never had a water policy. Earthen dams are very much needed and the repair of those. So hopefully ARPA can help us propagate a plan here that'll outlive this administration, that'll outlive this generation. We want to model ourselves out of the nation of Israel. They turned a desert country into a blooming country where they grow food. And when there's calamity or a natural disaster, they're amongst the first nations to show up with food, with water, with supplies, helping. And I know that kind of bucks the trend amongst the news that's out there, but they are. We've seen it happen and they will be. What if we, as a Navajo Nation, could do the same? Be there on the scene, Johnny on the spot, Navajo on the spot, providing supplies, food, and water and sustenance to those that so desperately need it. First, here on the nation, we'll take care of our own people first, and then we'll go out abroad. And so that comes with capacity, and that comes with what our president shared earlier, true nation building. This ARPA office that will be set in place. We appreciate our 24th Navajo Nation Council and their leadership here as we as leaders for this perfect time as such as this. The leaders that are in place elected all of us to fight this pandemic. Who would have thought we'd have to be here doing what we're doing right now? And yet there is a calm, I sense. There is a leadership, there is an authority that we can take once we give God his place, his due, and then we're able to be empowered with wisdom, knowledge, and the ability to bring forth great change to the Navajo Nation, as our president has said. So I've always said that we need to catch up. We're not building back, we're catching up here on the Navajo Nation, catching up to the times, 40 years behind the times in economic infrastructure and business infrastructure, and the ability to provide for our people. What the pandemic has taken away, this leadership is about putting back here with our Creator God's help, with the money, 1.8 billion, potentially more coming, 714 million from CARES, all in the ground, hanging in the air, bringing broadband and internet capability to the deepest reaches of our great Navajo Nation, true nation building. And then once this is all set in place, guess what? Then the dream building can commence. Dream building. Think of it, Shadina, dream building. How many of you are preparing yourself for not only rain, we're doing that right now, but the rain of future times, of future prosperity? Early on in March, April, May, we were praying for a bountiful harvest on this crop coming with all this rain. Oh, I'm looking out at the fields out there. There are a lot of people's corn is so high, and and I realized too, a lot of other people who planted their corn isn't as far advanced. But one by one, these problems will be solved, and they are solvable. We just have to abide by those principles, time-honored principles, in which to bring this change to the Navajo Nation. And using our words of our president here, economic development infrastructure, $1.8 billion. Would you, Shadina, all across the land, all across the Neta, as we know it, would you pray? Would you pray for leadership to bring about this change? And again, we're going to work like it depends on us, but we're going to pray like it depends on our Creator God, Shajat God. There's no way we could all bring forth these changes on our own, right? Because we all have our own agendas, but all unified. There is power in numbers, power in a unified stance. I believe we're starting to see that now. So I appreciate our 24th Navajo Nation Council's ability to work with the executive and our judicial, and we're all headed in the right direction. So continued prayer. So I appreciate you. God bless you, and God bless our great Navajo Nation. So with that, I'm going to turn it over to Dr. Jill Jim, our executive director of our Navajo Department of Health, who is doing an outstanding job leading us in this fight against this pandemic. So, Dr. Jim, are you standing by?
Yes, Vice President. Good morning. Yeah,
Oh,
Shinatani, thank you. Yeah, non President Nez, the Vice President Lizer, and Yikin Nosum Negi on COVID-19 do the whole Negi do de Shedej, Dr. Jill Jimmy Schedule. Don and Sunday look on the Shon Touchini Bush's chain do a shame district look as a phonate the Adona just under IEC na sa do sansa adoshe at Bilagana so I will briefly just talk about some of the stuff regarding COVID-19. We do weekly updates. We used to have two updates per week, but we only do one update a week now on Tuesdays. So I just wanted to welcome all the listeners that are on the Facebook account this morning. Here from Window Rock, we're just going to have a whole team of individuals from our Health Command Operations Center here that will be doing updates and all in relation to COVID-19, understanding that we also are experiencing the monsoon season, as well as previously had drought issues that we were talking about. And in regards to the Health Command, we remain in yellow status, and our team will report ways that we monitor how we establish these criteria to ensure that we conduct proper community mitigation as well. I'm also aware that the schools are back in session since last week and this week, so hopefully the listeners here can share information with parents and kids, and then most importantly, reemphasizing on our mask mandate that we still here have in the Navajo Nation. Although the CDC, the Centers for Prevention and Disease Control, has made several mask recommendations throughout the pandemic, we here on Navajo have maintained our position to make sure we wear a mask indoors and outdoors since last year. So I encourage everyone to continue to inform our visitors and tourists that are coming onto the nation to continue to wear their mask while they're in the grocery stores or other types of businesses or receiving tour services as well. And then just another reminder with the school, I will briefly go over the framework on the requirements that we have here from the public health emergency order so people are aware of the framework that we have. But I know that there'll be vaccine efforts that we're still encouraging. The more you're vaccinated against COVID-19, what you're doing is you're really preventing any sort of death or severe illness and hospitalization. We know that our individuals can still get sick, but they're not as severe. So just know that we want to still encourage everyone to get their vaccine to avoid any sort of fatality or severe hospitalization. And one thing we want to avoid during this pandemic is overwhelming our entire healthcare system. And in the two surges that we had, we really needed volunteer medical providers, and we also had to request for federal assistance for medical staffing to make sure that we don't overwhelm our healthcare system. If we didn't receive the assistance from the federal government and some of these volunteer organizations, we probably would have been in a worse situation. So really, our healthcare system needs a lot of work, and we just want to make sure everyone does their part, and that's prevention. A lot of this is based on prevention, wearing your mask. As President mentioned, when you're out there, wear your mask, and it's very important. There is no shame in wearing your mask, and even though people might look at you really odd, just know that you're protecting yourself, anyone at home, and coming back into your workplace, you're protecting your employee, your coworkers when you come back. So travel wisely and only travel if you need to. So I hope that we don't experience another surge, but it's really up to us to make sure that doesn't happen. The only thing I think I always want to encourage the communities to really look at is the health advisories that we issue out, and we still issue those out every week. I think Del can go over that during his presentation. In those communities, we really encourage schools in those communities to take extra precaution just due to those advisories indicating there are a high number of cases, more than usual, in those communities that are listed by chapters. And so we'll briefly go over the framework for the COVID-19 so people are just aware of this. I just wanted to share that briefly here. The framework is on the Navajo reopening .navajo-nsn.gov, so you can just Google that. Basically, schools have the option to provide in-person, hybrid, or virtual learning, so making sure that parents have a choice and a voice at the school level to administrators, and also ensuring how your students or child receives their education. I hope school administrators are listening to parents and community members. We also, in the public health emergency order, is requiring universal and correct use of masks at any level of transmission. Schools are open, but if there are high transmissions, we expect that schools make the choice of changing certain protocols and in their school setting. For example, there's the 3 to 6 feet distancing. Of course, if there's an increase in cases, we automatically want schools and our students to distance more. Student cohorting can take place at high levels. Also, cleaning and hygiene and ventilation is recommended across all levels, but as I mentioned, changing the frequency or intensity of these cleaning, making sure there's diagnostic testing, local health facility, and making sure there is contact tracing from the local health facility, and ensuring there is timely isolation and quarantine. Reporting is required to the local health facility, and there's a web page that we have on the Department of Health, and that schools are required to provide weekly public notification of any positive cases to parents and community members. And the more we see schools open, I hope that we can gain a better understanding of these requirements if they're being met. It doesn't matter if you're a public school, a charter school, a private school, a contract or compact school. So those are all the schools that we are providing recommendations. So that's just a brief glimpse of the COVID-19 frameworks, which allows school in-person learning this fall. So I just wanted and that's one thing I think that we need to continue messaging is the importance of taking care of ourselves so that we can have kids go to school safely. That's the important part of this COVID-19 framework is safely returning back to school. And so that will be my only message this morning. So and I'll go ahead and hand it over to Dr. Bird. She's also a pediatrician with the Tuba City Regional Healthcare Facility and also a member of our Health Command Operations Center. So take it away, Dr. Bird.
Good morning. My name is Dr. Burridge. As mentioned, I'm a pediatrician here in Tuba City. I'm also helping with the epidemiology and community mitigation teams for the Navajo Nation response. So thank you, Mr. President, Vice President, and Dr. Jim for sharing all the remarks so far this morning. I really just want to emphasize 2 points. So first is, as others have said, is to get vaccinated. And please, if you're not already vaccinated, get vaccinated today. If you have family or friends who have not yet been vaccinated, again, encourage them to get vaccinated today. There's definitely a new urgency to get vaccinated. As has been mentioned, the Delta variant is around and here, and it is concerning. Thankfully, these vaccines are safe and effective. They work extremely well at preventing severe illness and death, which is really what we care most about. We want to protect our communities, our families, our friends, and it is extremely important to get vaccinated. I did want to address one rumor that I've been hearing more commonly. I've heard people saying that they will get vaccinated if they get COVID. Unfortunately, that is not how vaccines work. And if you already have COVID and are sick, the vaccines do not help at that point. Your body needs time for the immune system to ramp up and be able to protect you from the virus if you were to be exposed. So please get vaccinated before you have any potential exposures to COVID. It will help protect you from getting very ill, and it's really important. That said, if you have had COVID in the past, we do still strongly recommend that you get vaccinated, and this is the CDC recommendation as well. There are really heard also a lot about concerns for reasons not to get vaccinated, some sort of contraindication. There really is only one reason not to get vaccinated, and that is if you've had a reaction to a previous dose of the vaccine itself, the COVID vaccine, or if you have a known allergy to one of the ingredients of the vaccine. And both of those are extremely rare. Otherwise, the CDC encourages people with many medical conditions to get vaccinated. And there's more information on the CDC website. But if you have any questions about these rumors or other rumors, please talk to your doctor, and they can provide more information and reassure you that it is safe and extremely effective to get vaccinated. I also mentioned what Dr. Jim had mentioned about schools reopening. And thank you, Dr. Jim, for sharing the Safe Schools framework. As a pediatrician, we are very excited that schools have opened this week. The data and the recommendations show that schools are safe to be open, especially with all the safety measures that are in place. Schools have been planning this for a year or more now. And Dr. Jim mentioned all the different components of the safety measures that are in place. Certainly vaccination for anyone who's eligible, for teachers, for students age 12 or older is extremely important. And masks do work really well. And the mask mandate is extremely important too. So if you have children that are school age, we do, as pediatricians, encourage you to send your children to school in person with the proper masking. But it is exciting that our kids can be back in school. Certainly it's been an extremely hard year, and we've been seeing that from kids that we've been seeing in the pediatric clinic. So are glad that the schools are reopening with everything, all the safety measures in place. So again, just those 2 points. Get vaccinated today if you're not already vaccinated, and happy that schools are opening with the safety measures in place. So I'm going to pass to Dr. Johnson at this point, and thank you. Have a nice day.
Captain Johnson, you're up next.
Everyone, hey, this is Captain Brian Johnson. Sorry, I missed my mute button there. But it's nice to be here this afternoon with everyone on another Facebook Live session to talk about COVID-19. I want to thank President Nez, Vice President Lizer, Dr. Jill Jim, and Dr. Burridge. I think we've heard some consistent messaging that is happening across Navajo, and not only Navajo, but when we look around throughout the United States to see what's going on. And I really appreciate the numbers, the data that's provided on these sessions, as it helps remind us where we've been, where we're at, and just the important messaging that needs to take place. I like to think of this Facebook session as a way of being transparent with the Navajo people. The Navajo people have been tremendous in terms of supporting all of us here on the Navajo Nation in terms of following the guidance provided and, continuing with the mask mandate, mask wearing, and particularly I've been truly helpful with the higher vaccination rates that we've seen here on the Navajo Nation. And I just want to say thank you to the Navajo people for that. I also want to give just some credit continuing credit to the healthcare workers across Navajo area, indifferent of which facility they may work for. The work continues. And we know that over time, I believe as President Nez said, there's been some ups and downs in terms of the number of cases. But we want to continue pressing forward to make sure that we're doing everything we can, of course, to protect our loved ones, our elders, and friends and relatives. So, again, thank you, everyone, for that. I'll try to keep my comments as well a little bit short today. I know we had a number of individuals on this particular Facebook session giving some tips and data and just some key points. And I did want to mention that, again, I feel that we continue to be in a critical point in this pandemic. We went through a huge, of course, couple of waves here on Navajo Nation. And we're in a point now where we continue to hear about this variant referred to as Delta. And of course, it's not the only variant that's out there, but it is one that's of concern because we're seeing across the United States that the positive cases, positive new cases, or what we refer to as incidents of cases, are predominantly of the Delta variant. And so that's important for us to know. And why is that important for us to know? Well, we know that the Delta variant is very transmissible, as if you compared that to the original COVID-19 virus that we were dealing with. This particular variant is more transmissible and can cause more severe disease, including hospitalizations and deaths. So it's important that we pay attention to this. We've, as I know President Nez mentioned, we've learned a lot throughout this pandemic. We've learned a lot how to respond and react to COVID-19. And there's nothing, there's no magic. There's nothing different than what we've already been doing. What we need to do is remain vigilant and continue the practices that we're doing, and make sure that we don't get too comfortable that everything's okay. We want to make sure that we're continuing to follow the practices that we've been talking about and sharing with the Navajo people. One of the trends that we're seeing within the Navajo Area Indian Health Service is increases in the number of COVID-19 tests that are happening at our service units. And so we do know that people are listening and that people may be experiencing some symptoms consistent with COVID, or maybe they were exposed to a newer case. We have seen some numbers over time go up. We see that we do monitor those daily case numbers. And we're seeing that, again, the number of tests happening at our service units are increasing. And we want to make sure that people continue to know that those services are available, and that if you have any question about whether you've been exposed or whether you might be experiencing some mild symptoms or even more serious symptoms, it's important to get tested. Again, we use that as a way of looking at the Navajo Nation in terms of a bird's eye view and understanding where the disease is, where the virus is spreading, so that we can pinpoint prevention using contact trace teams and others to keep this virus in check and make sure we're doing what we can from a public health standpoint. So I know Dr. Burridge made some excellent comments about the vaccines and some questions that have been put out there and some misinformation about the vaccine and those kind of things. And again, I think it's truly important. And one of the important points for the day, I've mentioned this in a couple of previous sessions here on Facebook, is that we know that there's inaccurate information, whether we're talking about locally or in the media, on radio channels, and other sources. There's a lot of misinformation that has likely caused some folks to shy away perhaps from getting vaccinated. it's important to understand, and this has become a serious situation here within the United States for the misinformation that's happening out there. And so we always want to go back and remind folks that it's important to really make sure that where you're getting your information from is accurate, looking for credible sources of information, organizations that have that are reputable in terms of the media industry or other outlets. And I know that can be a little tricky to understand who exactly that is, but just making sure that we're not just listening to anything and everything, whether it be on the internet or otherwise. Locally, we do know that our local health facilities do provide excellent information. And if you have questions about the vaccine, about its safety, feel free to reach out to your local health facility and talk with a provider, talk with a nurse that can give you accurate information so that you know you're getting it from a source that is certainly trustworthy and credible here on the Navajo Nation. We continue to advocate and encourage folks to get vaccinated. As Dr. Burge mentioned, if you have not been vaccinated at this point, it is important to get vaccinated as soon as today. With the increasing numbers of cases as related to the Delta virus, we know that the vaccines that are presently available and will continue to be available, we do know that they are effective in reducing severe disease with COVID-19. So really, really important. If you have friends, relatives, other loved ones, be sure to reach out and just ask, have you been vaccinated? And encourage folks, because we want the best for the Navajo people, and we will continue to advocate that. We know that the vaccines are safe and effective, so please help us with that. We would surely appreciate that. And again, I just want to reiterate that we do have plenty of vaccine at our facilities. We continue to receive shipments as needed, and we continue to just try to encourage the public to come in and get vaccinated. We do still receive some questions about booster shots, booster vaccinations, and at this point, we know that CDC, NIH, and others are continuing to be engaged in scientific processes to look at whether or not a booster will be necessary, and if it is going to be necessary, when that might be. And so this would be this Facebook session here that we have at least weekly, sometimes twice per week. We know that we'll be sharing information as soon as we get it here, so that you're informed, and I'm sure you will also see that in some of the media outlets when and if the boosters become a recommendation. So we'll continue to follow that, and we'll try to provide help with getting that message out. I just want to make sure that folks know, I know this is, again, a number of speakers here, but again, we stay with the important points, and I got several of the important points are the number of cases on the Navajo Nation is staying relatively low. We have seen some upticks on certain days, and we do know that some of those, many of those actually are related to group gatherings. So remain vigilant and continue to wear your mask, continue to try not to be in groups, in large groups. Again, we continue to see that. We are monitoring the variant forms of COVID-19, and although we talk a lot about the Delta variant and how transmissible it is, there are other variants that are being monitored. We appreciate the assistance of the Department of Health here on Navajo for assisting with that as well. And we should all continue wearing our masks, whether we're on the nation or going off of the nation. that is still a recommendation, particularly now that we're seeing Delta in some of the areas surrounding us here on the Navajo Nation. We heard earlier about Utah and Arizona, and we know to our east that there are some states that are also seeing significant increases with Delta variant. So that's important to make sure you understand. Continue washing your hands. That's just a good old-fashioned prevention method for all kinds of things, but I never can state that enough, that washing our hands, using hand sanitizers are extremely important, particularly in public settings. Our testing will continue at our various health facilities, and we encourage the public to contact us or to stop by and get scheduled or get an appointment, or otherwise just get right into testing if you feel you need that. We want to support you in that, and that our vaccinations will continue, and we're going to have an ample supply. There's no issues with us getting the supplies that we need. So please know that, and please take advantage of that. And then, again, just wanted to say one more time, avoid misinformation or inaccurate information. Really, really think about where you're getting your information from, and focus on those credible sources of information out there. And let's continue to try to reach that community immunity by protecting ourselves, protecting our family, and protecting our elders. Get your COVID-19 vaccination as soon as you can. And at this point, I'm going to turn the time over to Mr. Del Yazzie of the Navajo Nation Epicenter. Del, you're certainly up.
All right, thanks, Captain Johnson, for handing over the mic. Hello, everyone. My name is Del. I'm with the Navajo epidemiology team and also the COVID epidemiology team as well. We are the ones who compile the numbers each and every day. And then we also provide Gady metrics updates with a time frame of 2 weeks each time. So from July 16th through July 29th is the time period here that I'm going to show the numbers. But first, this is our Gady matrix that we follow. The far left column here are the metrics or the indicators that we track each and every day. There are cases that we track, testing capacity, which includes our test positivity rate over a 7-day time period, public health capacity, which includes contact tracers. I know President has mentioned how important they are with tracking our cases currently, especially with an uptick in cases. And then hospital capacity as well, ICU beds and regular hospital beds. And then vaccination data as well. So these are the indicators that we follow every day. So, and then all of our different colors of the gating levels. So Dr. Jim mentioned level yellow, so we'll remain in level yellow. And here's our 60-day recent cases and trends over a 60-day time period without border towns. So this you see the gray bars in the background here. As you can see, more of the recent time period within the past couple of weeks. We've been seeing an increase in cases, which you can see on this red line, which is the 9-day weighted center moving average. It's self-explanatory pretty much. It is going up mainly because of the increase in cases we have been seeing within the past couple of weeks. This is our latest map, just on the right here, 106 cases over a 7-day time period from July 23rd through July 29th, which puts our incidence rate at 67 cases per 100,000 people, which is actually in the orange level. But and this is our heat map. As you can see, Utah and Arizona as our border states, really with seeing an increase in cases over that 7-day time period. Colorado and New Mexico too has seen an increase in cases, but they remain in this orange COVID disease risk status. And then on the nation, IHS service area and 638 facilities, service areas, Gallup with this darker red color with, they've seen, I think like 42 cases over that 7-day period. So they saw they had the most cases. So they fall into this 100 cases over 100,000 people as an incidence rate. But really, we are seeing cases throughout Navajo. Just that worst, highest number of cases was in Gallup service area. Just some additional metrics here. Testing capacity. Our 7-day positivity rate is at 6.1%. It went up from 5.5, I think, last time, so it did go up a little bit. And then 411 average daily tests in the last 7 days. It's been hovering around 410, 420 tests for the past couple of weeks. And testing has increased as well on the nation over the past 2 weeks. Hospital capacity, we're hovering around 70. This is below here, but really around 70 to 80% hospital capacity as far as hospital beds and ICU beds. Then we're at 7 contact tracers for every new daily case, which is adequate. We want to be above 5, so we are at 7. This is just an epidemic curve for the US and Navajo, the US in blue and the Navajo Nation in orange. As you probably all know, that we've been seeing an increase in cases across the United States and Navajo Nation as well. As I mentioned, the past couple of weeks, we've been seeing an uptick in cases. Dr. Jim mentioned some high-risk chapters that made our list this week, which is a 2-week time period from July 16th through 29th. These are chapters who have seen increase in cases over that 2-week time period, and which puts their incidence rate over 100 cases per 100,000 people. So you see the list here: Ganado, Huck, Indian Wells, Kayenta, Low Mountain, Manuelito, Pinon, Rock Springs, and Tisto. So they're all kind of, as you can see here, chapters are spread across the nation. And then IHS 638 service areas with 10 or more cases over that over a 7-day time period from July 23rd through 29th. This includes border towns. So Chinle, with the 22 cases, Crown Point with 10, Gallup, as I mentioned, with the most cases over a 7-day period at 42, Shiprock with 29, Tuba City with 15. So when I mention border towns, for example, Shiprock, which includes like Waterflow, Kirtland, Farmington, into like Bloomfield and even Aztec, those are examples of border towns. So communities that are not on the nation. U.S. COVID picture here. Really a lot of red states here in the southeastern portion of the U.S., including Texas, Oklahoma, and Nevada and Utah, and Wisconsin and Michigan. And so it's a COVID profile picture across the U.S. And then counties, really there are like no immediate counties within our Navajo Nation area that's red currently. But there are other counties in Arizona and Utah, as you can see here, that are red. And then moving on, this is the COVID profile, variant profile from CDC for the United States. You can see this orange bar is the Delta variant. As you can see over time, Delta variant has become really the dominant variant across the US, making up about 82% of all variants that are sequenced across the US. And last is Dr. Jim mentioned we're going to remain in the level yellow for now, for at least another week. We'll continue to monitor the cases and reevaluate our gating criteria as far as phases, where we are a week from yesterday. So we update these numbers every Monday. So we'll see where we are next Monday. So I'm going to stop here and hand over the mic to Shema, Dr. Fowler. Go ahead, Dr. Fowler. Thanks.
That is yash do na he. Yat is kedos na other Dyson at flying. Crochet picket it honey out codon hat na hash net ole. Should edge shady my dish gives nin slant footage in pashes chain kapahata should shade out as edisonale. Totus a hole yene are is a shake quint could it's a hot Sunday a. Nanish itala day not ani itlini artishananish division of human resources ABR a. Shananish not a aro kodo is a in dan lini do not an lini president aro shiyaj vice president a kodon hilchinahon. Ni hilchina da huit na kid mo gonna a ya hun and hilche huit the kodon hinat ani ya na oka a di kodo. Because na state at the petit nini na ni he kodo pa na huil neto a kuje kodon hil ilcha inizan. It's a kodon hinat an lini ani atina ni do sa and ordinarily a kodo nikanan ni konde sada an hi init a be ta huil ya a kodon hi cheaton hi ze pitni betada des balon dakhe ado is it lini pahas li ki nakahata ol nito ben hata ol sich ot a kodo ni he jo pa ni nani ni ke chikedo shne ado kodo shi ye ha zi yadi ashi ni hi chido ni ze betada des bal ben dakhe hi ni da ado ba yata nasne hala kodo ye nal wato sato ye bene pa ado hago da ada do ya gota bene ye honno shik edo shne akon chiyan da hat ol was ado satan da iliego da akon bene ye honno hons do gas ada na kish that out da hons do as chine ati aho what in the house kan ate no sis ati oyo ba has ti ye jon hikne kodo Adona ne Dr. Birch le tonanestij aj elchine be is inagina adol satona al kahi adol satobik is des AAD kodo is bahazli ashwanish edo shidne the question tanas it's adapedi nini ado chostoit ini saho and ordinarily Delta variant is nini nahan ni ibn nache ashwande kodo is lini nahato ni is Liniki Bahasni Materna Pfizer Desne Johnson and Johnson Desne Benach Satona Nahatorni Hala Diego Yichna Party the Cosna States Adapati Nini Do Bedesne Ena Ado Sato is in Lisa Ashine La Nihitine and Lini Za that Hiltahadne Adorisn of as in Lini which at the Hatofne. Hala it's season lido is it na rajito dashnihiye and nito bestahazen. Ado ultrato andalia ban histahojan ultra andaliai kohashine na ultrapas ango ad safety plan dan lini bella that seed lido juno con hachina ultra o ntado ka needs in a cop nha ultra anosnido ultra jebel argent dashnishido نخالشنا نكتات تحتو تكبدا خلي أشانده أزين باهتا نخاهتا دولنيتو نكتشيتو نيزا أبتاتا تسبالون دا خيمتان هيتنا أروهن يا كابتن براين جونسون كدونات لني إخيها بديشني أرون نخيتو أسا أنو زنو دنيدا نسلني دي خالة دي هتان شعبن سكيسي بين هيلن تهيلنا Bigatnitzen von UA is Lini Nahatalia Kodoba Ahenitzen. Anahon AD Chostoit Ini and or Netliki Rashine la on hit akonde yet skin that na it ako yugo nan hines tra atinan hin akoti da al khan lini kha da jit da the course dan the test and dan hit ilni zel ego ajit des kid edo ba hen nitsen khala la shin the course dan no sin the kodo al kahin nan dan hit el kha jo be na hot sin hitne ado ani edi khashine lan hitne en lini o chinne chinne ko tahal na egi tata AGC yisini se dodi don hitne bel ka hot zoit dat islatin ha zon hinnaje o yu o chi de yichteli ado isino an hitne koje ezel iji jogar aj ezel in khad shina hatne ezel en tahalna aj hjo na bitol kil aro edi en lini pa hasbi khatneni ki aji ki to na kha ta doli a holno aho atinta shin ton hilpa has dole hilne aro di kodo booster hilneni ki hashine la le yasin da na na kha talia a caution le is tratus dante zida na ne ni jo booster vaccination hilne Akoden le yis tal in the CDC do kinahal kede atiyan dat ako ani sa pa na do ni tan hito ni no she al koto ben hit na hoton ni akonde etefni etefni ton hit ne ko ata akosia ni hichi don hize abedata des balon da ken hilla ta khan ta kis ado di nahona atani gito apa akosia do beta akosia Aro kudoshi yaj indidia hol ne yadi ya ishtat so as khans ata hiol katon le natino anas yol katne da kudo yen hil nahas ne jo a quit jun kudo el ke de yen ni aj epidemiology team de linda al kahido big eho kunil ini gi jo ade en khachne sir case twisani de ilnish ajin khach ke de yen ni Edo Kodoba Hetne since says zero, Nihido Yegon Dashino Tindo, Adshido Sato Anahosha. Okade has 20 Jidget, Ya Ishta Celesat Ata Hios, Kate Dado Leya Ishta Soche. Tatino Asa Astro Ida Yadi Benada Dos Naigi, laid Ya Ishta so. Natino adha yos katon le natino nas yos kasije jo has trankije asa nezatino has tranked sabenada to na ako ba ako no sendo ba ako siyancho atina ni tan hiti ne ako din al kahe atinta al ka adon le tosjije en hitsa oyo tahana za do ye kotanda o tahza o yidije Arodi Israel ebesnahas anje shaskahi ata hononde Arodi na alkal lenido atinda alkal ado hebik ahonos enido mikitreshin tahadne Arodi Israel nahata yaidi islatingo hazoja ajido la denates kid akodon hinat anin linigis selendini kodoya hol na din das neshido Navajo Nation banda nishi ajito tenates kid edo ohen kiti nido le ze nahata yai ado hana nanes kiditi islatin hahot zojin hinaja eye got tenates kid akon he aho yaho nanar kid onayit la akokodo yaho na edi high risk nini khad la ye kona nada ni chut nini na adik kidi look antage lacanado Aroha Indian Wells Kayenta Lomel and Manuelito Pinon Rock Springs Ado Tisto Aja Yego des Kitchikedo Shidne Eta Aholiano Ada Atsahoma Gina Hasotra Ala Yego Nasni Hodo Ya at Eta Ihitash Elna Ako Kodo Yen Hilta Holne Ehinta Iltahi Ada It's Ada Amy Hilne Akoti ajit in leisure sabata dona natino anarchy. Adon le crown point ines na George it is dino anarchy. le nat ani neje natina anas ado tunanes de ata jodi the more akonella ebeta dolna dolan shikero shidne akonde Nihiti the Naval Hazard a yego ya gonates kidney John he need ebeta wheel ya Aro kodo ya mahasne nihinago yego the nata des kid Akodich ostoit ini lahond or ni variant nini ya the updated information at the ajen nade ka konde aj edich ostoit lahond or nisi kudin hikant ne Asa neza dina atsepi akonella betadonna akodi ati soiki bi kashikero shne atodo tribi ati kata kodona hapa ahunasem ani hi enid out ado kodon hashino sa alala jadeno snish o hiha chikero shne is Salah nollini don le zel ije de nollnishiki nolltonle kinahas ago alaje de nollnishi ihe ado hashine lai kodo de nen linin hits biketa hasti koda haslo it ado shikedo shidne oshi yego ka ini nido tatsodi zindo yo ne be khansi keso ado eda kodo ben hisna huilne le da haslago ashhod elsen onana le ani yanal kil o ni kedol to hot kodin hichi don yize abetata des balon da kay ze atona kha alne ko en kha dolni to ashi ni an hin honni ti ninde na alkhahi akon alkhalati ni hid nebel kha zoj da in shiki jo ek apanet ani nasko ha otsit od jilnistole dodin zno khan nahot el khatole johot ya pado banet ado ashkhone bin ye holnod nahot tlahon hilda atje ado an ende sto ado kohonot ada akodi olt khan linije sto an dal net khashine na ani lini da honno tine hesti benat da dan la ado principle da doria ado ba alt khada khodo bedi ni khodo na ani lini ashhode amado je annale shay in sahida baltahne di kwa ultra an dal ne khajona bikia tahti yat on khalchin da idol khata bedi no ado ajnat ani da tahalla ado zel ijin dal nishta hajobe hilkhosne bena no kendina khalchin lini da hashine na shi ani na khalchin ikene da nesli inde Johnny hi kodo edi ne ani da oltra de natsa de be ba hoti o lago aba hasti ie kojadil cha apen se kesi do sato ba inosen do sato ye oltra ye hoidos ot edo yuhidos jo in-person learning ado hybrid virtual oltra ulyenda ba bansela akonde jo ajinat ani lini do kwalno ko aj barnel ya to hajo ta shonta isa aj ultraje nat ani dan lini ashhode kodo amado je ado chinda da ultra hajo bebel ta hasne akota ya dan zenti bichinto bezeta ta tespali ado ba ya tan seneta batone jo echi to sasona ntim Akashik Edo Shidna, you go here, Nakines, the qua Nahayan Danahan Sni. So the Ado Shidadol Shidodne, Lado Shidadol, Shidadol, Natazo, no Z et la. A what it or stoy in it or stojo by. Johot Kodo Amasane. Anale tatani lini okot yego yena kien ho wadona antkin hatahaz laha khashine na be na that ni tino kona ho jish kodoba a hensen ho wat in dat nog tini. Ik heb ik edo shit ne to the an hini town ja. But ishi da bata hoil contact tracers that dolia variant da gating matrix that dolia no shelter in place curfew that dolia downward trajectory the arok at every opening. Oh, you go yen and hines tra. Akon hit the neck the nanny plenido nothing tin oh you na hayi na yotla. Ha ini no en hila chikedo shidne. Ado ata akhunitsino en hila. Ado yo ne yego ni ne yitla. Ado ohui zache an leje nan hinnen. Pa iwet ela chokwinzen akwande yego ha inosne. Ado ha jobe na nothin. O yuni hi kede na ha alchinen hi token hi nalikhe be na nothin. Sho di kwa do al ida kwa baso tje. Ni hi zan lini baso tje. Jo an leia til tje inde de ne ye hasse. Hey das be mache das be je. Hade das na rat benal loshi dat holno anne. Jo khodanini o hayu. Do ash kadash has twido sani da do hahodo selta. Jo a de shiye da hanel ko a de snishik edo shidne o yugo ye nan hin. Di de kosnat a da bedi nini na khan ni a da a holia a jo ben na hinot hin de kwi de dash ben hilna hodilne o yugo ye nan hin. Na da twido sani ita no chon da hashkele ko ba honizi atila a hodat ka ida hodet ne ala slahate be kha atzne aslahate ben kha odzi o be ent edole be dites ado de dahni sani his twidi leta ado dahni na haski na sa do leta ado dahni na achne ko do leta ba ant ba sins jot anda tino la ba honizi shikedo shidne ko ashi enila ta hashke be yeltinde do hashke et edan hitani nantin et enda dolle ado nat ani itlon do khazad lini patsthe khala wa essa wa hasti khalchna khakeya do sata opejna Daninde och kolla då da hade Nielsen da sig kli hot anhanli och hat chjuko da alanje nitnen jo eshi ben da hinithin khada da les twisani terkeje keni ye hataton doka bi ga khode doni kunat ani ni tlonla sado ya at ni hitato ye natakha ado tan hito nen elto ni hito den nitle Sani nitle has twi nitle. Ado a be nil soit a kodo be enelo be eneja. Ashi eni o yu saho enda has inde. Jo edo sato ni hite ben hika do lwa. Kwa shi la an hizad bi gahata di no. Nish echa ibe di lwa akovat on il on was akati do. Akonde jo be eta akwi yado be eta akwinitzen chik edo shidne ba nan hoshka kodo nasko ne nije be eta akwi yado le be na ni tindo le o yugo atka ne ye nan hinestra do shi anit ot an khan nida sata on tsi ilkes ye gon tsi ilkes chik edo shidne ko khalet ila yeche khata alni da halet jon na totta nini shido ta halno ado kon santa jonon hen na ta halti edo ba khatsa dilze ash na haltkin lini do zotsi ta do hitoni bitnin da haltkin hash ein jonon kompi ta na ta no khota sa yugo troshje da ta sepini aje bi halti beg ilye o yugo nan tinjik edosh ne Dito ash la ata ta haljinje bigata oshi yugo oh when you don't hit the hono at she edo shouldn't ko hen hidini dole ko she الجئنا نيلنا دولة أدو أتا أخوتين شكيتو شدنا يوتا هينو أني التهويزة أو كنت هوت أي بين داهيني تهندو إحلام ديتلي داهيد نصن أشخان دوا بانان هينوشكا نهيك أدول دولتو أدو تلزن بيخا داتزهي أيدو نتخاغو هيه دنبت تلزن قددين داهيك تسجل Ado di ben hagaj ajen so de zin eta any ado nar tostateno I ni hido nha hemsen wala be eta hasto it ado le eta so di zinot any hiketol to ado ba ado big edge eta edo al ida oda his dotsen ol ado khon sa koshen hikana de se hiya shik edo shina ado